On the truck drivers, I'll leave that to the DG to respond to, and I think it ties in with the issue of subsidized testing for the restaurant and hoteliers, restaurateurs and hoteliers. So I'll ask the DG maybe to add a word or two to what I have said.
Well, thank you, CS. Just to add to what Waziri has said, of course, Tanzania is a good neighbor. We are members of the East African community, and we are also members of the global community, including the World Health Organization. In accordance with the International Health Relations 2005, we are all obliged to report cases of COVID-19. And as our country, Kenya will continue to report, will continue to test and report on the cases that we get. And likewise, we expect our neighbors to continue to do so as members of the WHO. Of course, placing the mobile lab in Namanga was one to be able to address the snarl up at the border and also to ensure seamless movement of cargo from our neighboring country, from Tanzania to Kenya and vice versa. And we had agreed that even before, when we said that we are closing even the airspace, that cargo will continue to flow because we'll still have to eat. So it was just imperative that we place that lab in Namanga. But if a decision is made otherwise, for example, if that border was, for one reason or the other, not to continue functioning, that is the beauty of having a mobile laboratory, because you simply move it to another desiring site where you can deploy it into immediate use. In terms of the testing for the restaurant workers, the hoteliers, and the truck drivers, we had agreed that as a committed government, this will be a subsidized rate of 1,000 shillings for both the truck drivers and the restaurant workers. But basically, it is a subsidized price because the actual cost of the test is much more. We have not begun the testing of the hoteliers and the restaurant workers because in our meeting on Monday with the Cabinet Secretary for Tourism, Honaji Balala, we agreed that we are going to work with their respective associations, including Public Entertainment, Restaurants, and Association of Kenya, to be able to develop standard operating procedures based on the guidelines and protocols that we had issued before. So we agreed that on Monday, we are going to finalize these standard operating procedures, not only for restaurants, but also for hotels and also for accommodation facilities, so that we address this matter in a wholesome manner. And once we do the SOPs and we sign them off, then we shall begin the testing of the hotels and restaurant workers. Of course, the testing of the truckers has already commenced, and as information that we have shared with you, if you look at the disease burden from our neighbors, then you see that we have a big challenge. More so that these are people who are captured through our formal border point at Namanga, not forgetting those who come through the porous or Panya routes, whom we may not be able to access. And it is imperative again that we appeal to the people along our borders to be very vigilant and to be able to report on any suspicious movement from our neighboring countries, to be able to bring that information quickly to the security apparatus and the healthcare workers, so that we can be able to map out the specific interventions to ensure public health security of the Kenyan people. Asante.